Hello everyone, welcome once again to my channel. My name is Nurse Ayodele, and here on my channel I share the simplest ways to understand medical conditions that can help you understand so as to save life and also to save yourself. So if you haven't subscribed yet, today is the day you subscribe so you can also benefit. Go watch my other videos, learn, share, like and subscribe to my channel. Thank you. All right guys, welcome. Today we'll be looking at a very important topic, a topic that so many people do not really know about. So I'm going to be breaking it down for us to understand, and we'll be talking about liver cirrhosis. I'm sure most of us knows what we call the liver because we've all got a liver. We've all got a liver in us, and cirrhosis is a condition that affects the liver. Yes, it's a condition that affects the liver. All right, let's go. Your liver is like your body's natural filter. It works with the kidney to filter your body of the toxins that are not supposed to be in your body. So it helps to remove toxins, it processes food and keeps you alive. Your liver keeps you alive. In case you don't know, your liver keeps you alive. But what happens when it gets scarred, like when it gets bruised, injured? That is what the scarring means. It becomes bruised, injured, and all of that. So what happens when your liver is injured and can't do all of this job? Do you know what happens? That condition is called liver cirrhosis. All right, let's simplify it. What is liver cirrhosis? Liver cirrhosis means permanent scarring of the liver. When your liver has a wound that has formed a scar, on the liver, that is what is called a liver cirrhosis. It's permanent scarring of the liver. When the liver is damaged over a long time, healthy tissues is replaced by scar tissue, which is not a good thing for the liver. These scar tissues, they block blood from flowing to the liver, then reduces the ability of the liver to function properly. It reduces the ability of the liver to function properly. It develops slowly. It can go on for a long time. It can go on for years. It develops slowly, but when you leave it untreated, it is life-threatening. When you leave it untreated, it is life-threatening. So the liver has over 500 functions. Your liver, it has over 500 functions. So you can see why your liver keeps you alive. All right, let's go. It detoxifies your blood. It makes protein. It stores energy. That is why if it fails, your whole body will suffer for it. If your liver fails, your whole body will suffer for it. Cirrhosis, that is the scarring, can lead to complications like internal bleeding, fluid buildup in your belly, liver cancer, even complete liver failure. The liver can go into failure completely. So those are the things that can happen to your liver if the cirrhosis is left untreated. What are the causes or risk factors for liver cirrhosis? Number one is alcohol abuse. I've said it, alcohol doesn't do you any good. Alcohol abuse, hepatitis B and C infections. Most people do not know if they even have hepatitis B or C infections. Most people do not know. That is why you need to get yourself checked up for all of these things. Another one is genetic conditions like hematochromatosis, genetic conditions, certain toxins or long-term medications. When you're exposed to toxins, it is not good for you. Or probably you're on a long-term condition or on a long-time medications. This do not help the liver. because it just forces the liver to do what it's not supposed to do. It damages the liver, leading to scarring in the long run. If you drink heavily, you will come down with liver cirrhosis. If you have this overweight, if you are overweight and you've got a fatty liver, when there is too much fat around your liver, it is also not good for you. It is not good for you in any way. So what are the signs and symptoms of liver cirrhosis? What are the signs that when you see it, you know that your liver is going through a problem? The first one is fatigue and weakness. Even though this scarring may be silent in early stages, the symptoms only appears when it's worsened. That is why we need to pay attention to ourselves. The cirrhosis only appear when it worsens, when it's gone mad, when it's gone astray. That is when you start to see the symptoms. That is when you start to see it. So the symptoms you can see are fatigue and weakness, always tired, no strength at all, loss of appetite and weight loss, sudden weight loss when you are not planning to lose weight, sudden weight loss when you are not planning to lose weight at all, swollen legs, swollen stomach and all of that, swollen legs and stomach, then yellowish of skin and eyes that we call jaundice. Jaundice is as a result of liver problem. So when you see the person's skin will become yellowish, the eyes will become yellowish, just know that the person's liver is in trouble. Confusion, memory problem, bruising or bleeding, all of those things are signs and symptoms of liver cirrhosis. When you see all of these things, just know that there is something going on with that person's liver. Know that there's a problem with the liver. How can we prevent some of these things? Basically, it's majorly our lifestyle. It's through our lifestyle. You can reduce your risk by limiting or avoiding alcohol, limiting or totally staying off alcohol, getting vaccinated for hepatitis B. You need to get vaccinated for hepatitis B. Treating hepatitis infection early. Anyone that has got hepatitis and you've come down with the infection, treat it early. Another one is maintaining a healthy weight. And if you've got diabetes, maintaining your diabetes. Maintain healthy weight, maintain your diabetes. Another one is eating a balanced, liver-friendly diet. I'm sure there's a way we can find out about liver-friendly diets, that are liver-friendly diets. Eating a balanced diet is not what you should stay away from. Let us try as much as possible to eat balanced diet. So, is there a possible treatment or management for liver cirrhosis? Yes, medications to control the complications like swelling, infection, or even confusion. There are medications that you can take to control all of these things. Then your lifestyle changes. Change your lifestyle. Regular monitoring of liver cancer. If that person has got liver cancer, regular monitoring of the liver cancer. Then in severe cases, liver transplant might be the only option. Liver transplant might be the only option. So that is that about liver cirrhosis. Your liver is silent. It doesn't complain until it is badly injured. Your liver doesn't complain until it is badly injured. So protect it early, and it will also protect you. It will also protect you for life. So my challenge for you today is, if you drink so much, you are at risk of coming down with liver cirrhosis. Or if you haven't checked yourself, check today. Thank you. Join me on another time. Thank you.